So just to give you a quick rundown of the overdose epidemic that was spoken of, in 2012, the state of Rhode Island had about 170 drug overdose deaths. In Rhode Island, 170. In 2013, it was 232. And in 2014, it was 239. So that is the leading cause of accidental death in the state of Rhode Island, like far surpassing car accidents or anything else. So it is a huge epidemic that we're in, and that is due to a few different reasons. So people, so let's start with opiates. What are opiates? Let's make this interactive. Go for it, shout it out.
Opiates are usually derivatives of the poppy plant, opium, used for narcotic effects. And then one of the first was opium, which became manufactured into heroin by Bayer back in the day.
So a lot of people think automatically heroin drug users, and that's actually not the case. A lot of it is prescription opiates. How many of you guys have clients that have prescription opioids in their house? Could be Percocet, could be Vicodin, OxyContin. A huge one is morphine, morphine patches, fentanyl patches. So these are all prescribed pain relievers that are also an opiate, they're narcotic. So what happens is a lot of times people will be on a prescription drug such as Percocet, Vicodin, and they take more and more, and eventually that can progress into using illicit drugs such as heroin or fentanyl, which is out on the street. Also methadone. People that are on methadone, drug replacement therapy. So today we're going to learn about Narcan. It's going to give you an opportunity to possibly save a life. Narcan is a drug, when administered, will kick the opioids off the receptors in the brain and actually pull somebody out of an overdose. So what we're going to do is, how do you identify an opiate overdose? That's the first thing that we would be doing. And you can identify an overdose by somebody that's unresponsive, and their lips begin to turn blue, their fingernails begin to turn blue, very shallow breathing. And now you might ask yourself, well, how do you know that it's an opiate? Because Narcan works with opiates. It doesn't work with alcohol, it doesn't work with cocaine. It doesn't work with benzodiazepines such as Klonopin or Xanax. So it's strictly opiates. So how do you decipher whether or not that's an opiate overdose, and if Narcan is appropriate to use? So the lips will turn blue, the fingernails will turn blue. Very shallow breathing. And one of the first things that you can do to figure out if it's opiate or not is what they call a chest snick. So if somebody's unresponsive, you're calling their name, they're not responding. If you take your fist like this and you rub it hard against their sternum, if it's alcohol or if they were just sleeping in a deep sleep, but you'll get a reaction out of it. They'll wake up, they'll become responsive to you. If they do not react to that, chances are it's probably an opiate overdose that you're encountering. The first thing you want to do is call 911. That's the very first thing you want to do. And that's for a couple of reasons. These Narcan kits, if you administer Narcan, it will pull somebody out of an overdose, but it might take time to do that. And these kits are really just designed to save somebody long enough for the ambulance to come. So you're not, we're not EMTs, we're not doctors. We're just literally trying to get these people to a hospital and keep them alive long enough for that to happen. So you want to call 911. The second thing that you can do is begin rescue breathing. Is anybody familiar with what rescue breathing is?
CPR?
Yeah.
Yes. Like 30, is it 30 to 1? 30 to 2?
So it's similar to CPR, but no chest compressions.
Okay.
So what you want to do is you want to lay the person down flat on their back, tilt their head forward, make sure that there's nothing blocking their airway. And what you do is you pinch their nose and you breathe in their mouth, two quick breaths. And then one breath every 5 seconds. So what that's doing is actually you're breathing for them. Because an opiate, what people don't realize is an opiate overdose is actually lack of oxygen. That's what it is. They're shutting down and they're not getting the oxygen that they need. Hence, the lips are turning blue, the fingernails are turning blue. So you're actually just providing them oxygen. So you can give them rescue breathing for a period of time. If they're not reactive to it, within 2 to 3 minutes, you can actually give them a dose of Narcan. So anybody who's interested today is going to be able to get a kit of Narcan. Narcan comes in 2 forms. There's an intranasal and an intramuscular. What I have today is intramuscular, mostly because it's more cost effective for the organization. And so I'm going to show you how to use that. There is intranasal available at pharmacies. You can go into any Rite Aid pharmacy or Walgreens and go up to the counter and ask for Narcan. Go right up to the pharmacist and ask for Narcan. You can also bring your clients to the pharmacy themselves and get them to do it. If you have health insurance, most health insurances cover it for free. Sometimes you'll find like a $2 or $4 copay associated with it. But that way they'd have access to the intranasal if they were more comfortable having that rather than the intramuscular kits.